and take a seat. My name is Lee and I am the medical assistant that's gonna check you in, take your vital signs, and just figure out what's bringing you in today. So, with that being said, what time do we have an appointment for you? Okay, you are right on time. All right, so it looks like you are coming in today for concerns of a breast lump. Okay. And which breast is it? Your left. Okay. You're right. That's okay. Okay. And how long have you noticed that lump for? A couple weeks. Has it been growing at all in size or? Okay. And is it tender or painful? Pretty sore when you touch it. Okay. Understood. Okay. Have you noticed any skin changes around it? Redness, scaling? Nothing surprising. What about any nipple changes? Have you noticed nipple discharge, nipple inversion, where like the nipple looks like it's getting pulled inward, dimpling? Okay. And as far as your other breast, you haven't noticed any changes? Nothing there. Any changes to medical history or medications that you've been on in the system? Nothing. Haven't tried any new herbal supplements? No. Okay. Have you noticed any other changes throughout your body, or no, just this lump? Okay. Is there like heat or warmth to it? Does it feel hot or infected? No? Any new skincare products? Any new body washes that you've been using? Any new bras that you've tried recently? Okay. And do you smoke or drink? Excuse me, so sorry. Do you smoke or drink? Okay. Baby stuff, pregnancy stuff, what are you gonna do? I'm just happy I can breathe right now talking to you. Seriously. Okay. All right, so let me see. As far as family history, anyone with a history of breast or ovarian cancer, any like GYN related cancers? And that's on your dad's side. And do you know roughly how old they were? Okay. Okay. Understood. All right, so I think I've gathered all the history that I need. So we're gonna do your vital signs. Is that okay with you? For sure. All right. I'm just going to slip this around your arm here. There you go. Grab my stethoscope. So just give me 1 second, please. You could rest your feet flat. Blood pressure appears normal. You want to slide your arm out of there? There we go. All right. Just gonna close this up. Just gonna start a chart here. Do you by chance know how much you weigh? And what about height? Okay, the next thing I have is just a temperature check. This is just going to go right underneath the tongue. Okay, underneath the tongue, please. There you go. Good. I can take this out. Let me throw this away. Put some hand sanitizer on, and then we'll finish our final rooming documentation. And Leanna, the PA, will come in and do your exam for you. So I have all the notes here for Leanna, the PA, to look into for you. So you should be all good there. I have a drape here for you as well. Basically what you're gonna do is you'll wanna take your top off only, but everything bottom-wise can stay on. You'll take this, you'll wrap yourself, to feel a little bit more comfortable, and do a breast exam. May do some measuring, may do some marking with a pen. So we'll see. We'll get everything figured out for you so that you have answers and reassurance. For sure. So I'm going to put that right behind you there just so you have it. And I will let Leanna, the PA, know that you are all roomed up and ready for her to come in to do the exam. Not a problem at all. All right, she will be in shortly. Come in. Hello, it is very nice to see you. My name is Leanna, and I'm the PA that will be doing your breast exam today. Lee, the medical assistant, sort of left me some notes as far as what was bringing you in today. You noticed on the one side of your breast a lump that's been there, kind of tender or painful when you press on it. Okay, but you've noticed no other skin changes, nothing new to your diet or lifestyle, no new medication changes, and no other symptoms throughout your body at all. Would that be correct? Okay, yeah, so we will be sure to do a thorough breast exam for that side that's concerning you. We'll do multiple tests here. Do you have any questions at all? You're okay with me doing a breast exam? Awesome. Just wanted to make sure. Alright, so what I am going to do here, we'll just put some hand sanitizer on. We'll get my gloves on. As far as the other breast, though, no issues there? Okay. So we're just going to put these gloves on. So we are just going to start with the standard breast exam, where I just feel to see if I know any breast tissue or, breast lumps at all. So I am just going to lift this side a little bit. And again, you let me know if you get too uncomfortable. infection, and then a breast. It's right over here. Yeah. Yep, I do feel that. Okay, let me assess the other tissue around it. So assess the areolar nipple area. Not noticing any discharge there, which is good. Would you mind lifting this arm for me? Thank you. I just want to assess for any swollen lymph nodes at all in the armpit area. Okay. I am going to take a pen light real quick just to make sure I'm not missing any skin changes with the breast. And then I'm looking at the area of concern here to make sure I don't see any signs of infection like redness, swelling, dimpling, nothing like that. Very good. Do you mind lifting this arm? Thank you. So again, I'm not really noticing any redness, scaling, any obvious skin conditions or new moles or lesions. So that is very good. Okay. So the next thing that I am going to do is I just need to make a marker of where I feel it, just so we can measure the area. And then just do like a sensation test in that spot. So you're gonna feel me pressing again. And I'm just going to make a little marker where I feel that lump you were talking about. There you go. Just kind of around the border. Okay. So we should be all good there. So breast is all marked up. I'm just going to do some general measuring here of the area of concern. Using this measuring tool, we will do one more just for accuracy, so we get the centimeters accurate with the millimeters. Okay, very good. Next is I am just going to put a little bit of soft sensation on the area. You let me know if anything is too painful. Okay, but you are feeling that, right? Good. Okay. Okay, so we are all set for that. Let me just take this chart real quick. let me cover you back up here. We are all done with that portion of the breast exam. So let's talk a little bit about it, okay? Let me just get some hand sanitizer here. So based off of the way the lump feels, given it's a little bit more tender, it's kind of a bit rubbery and, but mobile. The good news is I think what we're looking at is a very common breast condition in people your age called a fibroadenoma. Normally they appear in one breast, not both, and it could essentially have the symptoms of a concerning lump, but oftentimes it is completely benign and not cancerous. So what we're gonna do here, I am gonna put in a breast ultrasound for you for this breast. I'm gonna describe the dimensions of it, kind of make note of the history, and your breast is all marked up now so that the ultrasound tech will be able to see the exact area of concern. And then what will happen is they will do the scan. Of course, if they're not 100% sure of it being a benign fibroadenoma, they may recommend that we do a biopsy, in which case, just so you know, oftentimes the biopsies do come back benign, including fibroadenomas, but that is what we are going to plan for you today, okay? Yes, so I'm gonna put an order in for a breast ultrasound of that side. That is my top suspicion though, and just so you know, they are very, very common. So we are just being on the extra safe side just to confirm that that's actually what that is. Exactly. Always better to be safe. Do you have absolutely any questions at all about the plan? Everything makes sense? Good. So what I am going to do is I am going to take all these notes in your chart to the girls up front. They are going to put the orders in for you to get your breast ultrasound, and then they will give you the number to call and schedule that. Then what will happen is they will send me the report of your ultrasound, and hopefully I will be calling you saying it is just as we suspected, just a benign fibroadenoma, and then removing it is going to ultimately be up to you on how annoying it may be to you, how many issues it's causing for you. So we will cross that bridge when we get there though, okay? Absolutely, for sure. So get you covered up, you can get dressed again, and the girls up front will take care of you. They'll have all your information, okay? It is not a problem at all. It was very nice seeing you. Have a good day.